So good afternoon and welcome everyone. I hope this finds you and your family and loved ones safe and well. Thank you for joining us. I'm Eric Estes. I'm the Vice President for Campus Life. And it's my pleasure to welcome you to today's Healthy Brown webinar. It's part of a series of webinars over the next week or so on a range of topics. Today, we are focused on health and safety. We hope that you'll join the upcoming webinars and that will again range in topic. Today will be recorded and posted later for those who were unable to attend. We know the webinar format can be at times challenging, but we chose it because we wanted as many people to attend as possible, and we wanted to cover the greatest range of questions as possible. We're going to start with some questions that you all have submitted in advance, and thank you so much. We received a tremendous number of questions, and we will do our best to move through and provide answers to as many of them as possible. And then we will, after that, be able to answer some questions that you have submitted through the Q&A function. So we would encourage you to use that tool, and we will do our best to, again, get to as many questions as possible. So thank you again, and I encourage you all to visit the Healthy Brown website for more information. And now what I'd like to do is have the panelists introduce each other. So I think we'll start with Vice President Guglielmo.
Thank you, Vice President Estes. Good afternoon, everyone. My name is Michael Guglielmo. I am the Vice President of Facilities Management. Really glad to have you all here today and looking forward to the conversation.
Thank you, Eric, and thank you, Mike. My name is Tracy Mansour, and I'm the Director of Residential Operations in the Office of Residential Life.
Good afternoon, everyone. My name is Steve Morin. I'm the Senior Director of Environmental Health and Safety.
Good afternoon, everyone. My name is Dr. Adam Pallant, and I'm the Clinical Director of Health Services here on campus.
Hello, good afternoon. I'm Tanya Purdy, Director of BWell Health Promotion.
And I'm Tim Shiner. I'm one of the Deans in Brown Student Support Services Office.
Great, thank you again to my colleagues and to all of you for joining for today's discussion. I think there have been a tremendous number of questions and interest in testing. And I thought perhaps Dr. Pallant, we could start with you and you could share a little bit more information about testing protocols. Questions have ranged from how often, what will that look like, will students be tested upon arrival, will it only be symptomatic individuals who are tested? So if you could share a little bit more about plans for testing for the fall.
Sure, I'd be happy to. Let me start off by saying that we are having a very broad testing approach. It's mirrored by our peer institutions as well. I also want to say that there are some limitations even to the very best of testing approaches, so I want to kind of put a little bit of a caveat on it. Probably the most common question is, will everybody be tested upon arrival? And the answer is yes. What we want to do is to see how students are faring as soon as they hit campus, and should there be individuals that may be able to spread COVID upon arrival, that our team is ready to begin to support working with them and making sure that that source of infection doesn't spread quickly. Brown Health Services, which is a large group of us, are a group of very experienced clinicians, and we are going to be able to help everybody through COVID and whatever other routine health issues that we've always done. And we will be there to take care of individuals. Anybody who is potentially COVID infected will be able to come to us, and we will be able to test them and clarify whether or not what they have would be sort of in the category of more routine cold, as an example, versus COVID itself. There is a different company. It's a little bit too much for our healthcare unit that will be involved in the routine surveillance to take a look across the campus about whether or not COVID may be starting to spread quietly before us, or if there are a significant, perhaps, cadre of individuals who may have what we call asymptomatic carriage. They will be doing routine testing on all Brown participants, and that will be including myself, faculty, staff, as well as students. And depending upon the prevalence and guidelines from the CDC and our Department of Health, that will range from once every week to once every 2 weeks. So we will have a very active testing program. The caveat that I do want to put in, and I can answer questions later, is to please keep in mind that if you test negative the day that you arrive, that does not mean that you can't get COVID, that you won't get COVID, and that you may not be brewing COVID. The test is only able to detect people who are actively sick or within days of sick or contagious. It can't tell you if you've been exposed in the last week or two. So I just wanted to point that out, that I don't want there to be a suggestion that if you're negative, that means that you should be cleared to do anything without any thought of the potential of your interface with others.
Great, thank you, Dr. Pallant. Dr. Pallant talked about arrival and the questions about arrival. There have been a number of questions about move-in and how that will be done safely. And I was wondering if perhaps Director Mansour and VP Guglielmo, whether you would be willing to talk about, from a res life and facility standpoint, what are some of the things that we're doing around move-in to make sure that it's healthy and safe?
Thank you, Eric. I'm happy to start with the basic logistics regarding move-in. Move-in is going to be a staggered 4-day move-in to start August 29th through September 1st. There's going to be multiple locations in which students will be arriving at. The determination on the day and time in which they will arrive, that is going to be done beforehand, of course, but one of the things they are required when they complete their form of study and their housing questionnaire is they will be listing ranking the days in which that they'd like to arrive. We're going to advise them ahead of time of that day. Once they receive their assignment, they'll also have a time in which they can arrive. So once they know those days and times, they arrive on locations, and we will have setups where they can come, unload within that time period, go to their location and pick their key, and then go to their assigned room. Something of importance that they should consider is to pack as lightly as possible, possibly even ship items beforehand to make it easier upon move-in and unloading. Additionally, they will be allowed to bring up to 2 people to assist them with their move-in. Mike, did you want to add?
No, I think you covered just about everything regarding the move-in. The only aspect I would say is just thinking about some of the protocol on campus when you do arrive. Just following all the guidance, the in-state guidance, wearing a mask. There'll be plenty of signage in place. And if you do have individuals that are helping you, it will definitely be a requirement to follow those guidelines. So all the buildings will have the appropriate signage in place to help in not only moving you through those particular buildings, but also the appropriate flow and protocol when you are in those spaces.
Great, thank you. Director Mansour, there were a couple of questions in the Q&A tool about students who have things in storage. And I'm wondering if you could speak to that. You mentioned shipping things in advance of arrival or post-arrival. I'm wondering about those students who, when they left in the spring, had items in storage.
And had items in storage. So if students could, as I mentioned earlier, ship as many items as possible ahead of time, that would be the best possibility. For students who arrange to have storage here in Rhode Island, we're going to be coordinating with those companies to assist in getting the items into their spaces prior to their arrival. So we are working with those individual companies. We will also be contacting students as part of that coordination, and we will have those items within their rooms prior to their arrival.
Great, thank you. Dr. Pallant, I know that there have been a lot of questions about what President Paxson talked about in her announcement, a quiet period of 14 days when students arrive on campus. And I was wondering if you could talk, and a lot of questions about what that would look like. I'm wondering if you could talk a little bit more about that quiet period.
I mean, I can give you sort of a broad overview. I may ask for Tanya Purdy to also perhaps contribute some conversation about that. It's, you know, in those first 2 weeks, that's the time where we want, among other things, for people to start to get used to the new normal. Perhaps in prior experiences, this would have been a time for large gatherings, big celebrations, big dancing or parties. This will be a time for people to not necessarily be fully distanced from each other. We don't want this to be jail, but on the other hand, a time where people will be gathering in small groups with an attention to the fact that there is a contagion that could be spread. So some caution to that, not substantial large activities, attention to symptoms, and sort of a thoughtfulness about how to be together, but without necessarily being in large crowds. And Tanya, you know, can I pass the baton to you?
Yeah, absolutely. Thank you, Adam. I think you were spot on. You know, we will take that time of a quiet period to really focus on what are the intrinsic individual and community motivations for connection, for belonging, helping people develop skills where they can have social connection while physically distancing, helping people really understand who are the social connections that they have that they might want or need physical contact with versus those where they can start developing new habits to have connection that don't involve physical contact, and really helping people work through, I think, what are some of the co-curricular experiences that they want to have? What are new things they can be introduced to? What are new opportunities for co-curriculars that might arise that you couldn't partake in because of because of time constraints, because of physical distance? So I think there's going to be some really great opportunities for students to learn about how they're going to connect in new ways. And that 2-week quiet period really gives them an opportunity to plan that and to think about, I think, yes, how things are going to be different. Yes, how things it might initially be challenging to think through how they're going to overcome some obstacles. But we are really putting a lot of focus energy on training student leaders to think about new opportunities that can be presented to students for connection and for belonging. And some of that stuff is going to come from learning from students as we go. What are they doing? How are they partaking in activities? What are the healthy things that they're doing? How are they connecting? How are they following public health guidelines? And really having an enriching experience within the residence halls and on campus.
Thank you, both of you. Director Purdy, if we could stay with this idea of what sort of life on campus will look like, particularly outside of the classroom. There was a returning student who asked, you know, will they be living a solitary existence in their dorm room, and how will they sort of think about engaging with the public health guidelines in terms of life on campus. And I'm wondering if you could you know, expand a little bit on what you shared and maybe talk a little bit about this notion of pods that President Paxson mentioned in her announcement. Pods, I think, mean different things in terms of different universities' communications, and so maybe you could share a little bit about that.
Absolutely. So first of all, I want to say that when I first read that question, my heart really went out to that student because, you know, what we think of when we think about a college experience is a time for connection. It's a time where you're establishing your belonging and who you are and really developing a really rich social network. And so we are thinking about how we're going to be able to provide opportunities for that for students in a new setting. I do want to also say that this is something that we are all doing right now. So I'm learning how to do that with my friends and with my family. We also have had the time over the spring and now over the summer to really be learning about best practices in this. So what are the things that people have started doing for community enrichment that were virtual that maybe didn't work, right? And what did we learn from those? And then what are the things that people were doing where we can show that it really did establish a sense of belonging and connection, and sometimes in ways that weren't possible before, right? So new ways that people were doing that actually enhanced that sense. Thinking about pods and really how we are thinking about that concept of pods is really basing it on the idea that we want people to be able to organically form groups that are safe, where they feel connected, where they feel well, where they feel supported, and to really think through who are people that I want to be surrounded by that have the same shared practices as I do. How can we together create a community compact within our pod where we know that we're all engaging in the same safety procedures, we all have the same health habits. Maybe we're in the same classes, maybe we are all using the living on the same floor. Maybe it's a co-curricular experience that allows us to create the pod. But we really want this to be something that's going to follow best practices, learn from experiences of other institutions, some of whom are back in session already and are trying out the pod thing, and we're learning a lot from them. But also, you know, all of us who work at Brown and who are a part of this larger Brown family, we are living and operating in our own pods, so to speak, right now too. And so we're thinking about that, and we're listening to students, and we've been listening to students. So there is feedback from a wide range of students right now who are telling us what they need and want from a pod. And that is going to be at the forefront of how we're envisioning this.
Great, thank you so much. Continuing with this theme of life on campus and the questions we've been getting, a student asks, for in-person classes, how do students socially distance in the classroom? And I was thinking that, you know, maybe Steve, Director Morin, and Vice President Guglielmo, in terms of cleaning and maybe just generally speaking in terms of cleaning on campus, custodial, maybe each of you could offer some thoughts.
Great. If I could start, and I'll let Mike cover more of the cleaning. So for classes, a lot of very careful work has been done and continues to be done to ensure that in-person classes can be held safely. The larger classrooms, classes, as you probably have read, will be remote, and the smaller classes are being moved into spaces that can accommodate up to 20 students. And so, you know, we're actually, the group in facilities planning have actually laid out plans for each classroom that will be used to ensure that the students will be sitting, will be 6 feet apart. There'll be signs in buildings that will direct students in and out so that that can be done safely without having large groups congregating. And there'll be other signs to remind about all of the important social distancing, face covering, and cleaning. And in the classrooms, there'll be cleaning in between every class as part of the cleaning protocols. But I can stop there, Mike, and maybe you could add some more on general cleaning.
Yeah, thank you, Steve. Yeah, in general, in cleaning, I think it falls into 3 categories. One being, you know, our daily cleaning, which is identified within our cleaning matrix, which you can find online. But to enhance that, we've also rolled out a high-touch cleaning process. So in these spaces, such as lobbies and classrooms and those entries into buildings, we've really ramped up the protocol and the process around that to, you know, clean things such as doorknobs and going into restroom facilities and into those main building areas. And then the third area of focus in cleaning is a DIY program. So this is where we will rely on the occupants to really take a lead in cleaning the spaces that they also use or touch. So within the classrooms, for example, there will be disinfectant wipes that are placed within there. So a student, you know, to add to some of their safety and concern, they will have the ability to wipe down the surface before and after they use it. So I think with that 3-phase approach, we really have intensified the levels of cleaning on campus. It's also really follows the current CDC guidelines and also OSHA requirements for the type of materials we are using to clean. We are also deploying a series of touchless enhancements on campus. And I think this is really important in a lot of the restrooms where, the last thing you're going to be doing is using the paper towel after you wash your hands. Those are being converted to touchless. So as you leave those restrooms, you have your paper towel and you can toss it away. So I think those are some of the elements that really cover the basics of our cleaning enhancement.
Thank you very much. And you ended on a discussion of bathrooms, and there have been a lot of questions that people sent in advance about knowing that they will be in single rooms in housing on campus, but what will the particularly communal bathrooms look like? And I don't know if we could start with what the specific cleaning would look like there, and then maybe Director Mansour, you could talk a little bit about how residential life is thinking about bathrooms, and Director Morin, if you have thoughts, please feel free to share them as well.
Sure, I'll kick this one off, Eric. Within the variety of residence halls, you can imagine there's a series of different type of bathroom facilities. We have everything from communal to individual. So within the communal, we will be enhancing the cleaning within those. Typically, we're doing it once a day. We're evaluating to push that up to twice a day, depending on the occupancy and the intensity of use. But then we have the in-suite bathroom facilities where typically those are cleaned by the occupants. What we piloted this past summer with students who had remained on campus is an option for facilities to go in and do some frequency of cleaning within those spaces. Or alternatively, we had provided for individuals who had decided to opt out of the facilities cleaning, the DIY program. So we provided them with the appropriate supplies and instructions about how long, everything from how long the chemical or the cleaning agent should be sitting on the surface before they clean it, and the associated supplies. I'll turn it over to Tracy now, if she'd like to add anything to that.
Yes, thank you for that information, Mike. And I'm going to speak to how the look is going to be with the use of the bathrooms and the student ratios. And as Mike had said, we have different configurations of bathrooms. And since the Brown residence halls vary throughout campus, we have 3 scenarios in which bathroom ratios were determined. I'm going to start with the non-suite style that Mike mentioned. There are actually 2 scenarios within that. And students who are going to be sharing a multi-use communal bathroom within these non-suite style buildings, the ratio was based on a 3-to-1 per student per fixture. And to explain the fixtures, a fixture is a combination of a sink, toilet, and shower. Then also within the non-suites, we have communal single-use 1 fixture bathrooms, and that is going to be a 4-to-1 student ratio. Within our suite style bathrooms, that'll be every suite will be a 1-to-1 student ratio, in the sense that that bathroom will be used by everyone who is housed in the suite. And I think that, what this does is it greatly reduces the significant use on all the bathrooms.
Thank you, Mike and Tracy. The only thing I would add to that is, in terms of cleaning products, my office, Environmental Health and Safety, has worked with facilities management to evaluate the cleaning products that they normally use, and they are proven to be effective against COVID-19. And we are working with the purchasing and procurement group to get additional disinfectants and hand sanitizers. And we've also evaluated all of the products that we're bringing in to make sure that they are also effective and safe to use.
Great, thank you very much. I'm wondering if Dean Shiner, you would be willing to talk. There were a lot of questions about just general student support, questions about support for students on campus or off campus, thinking about, the idea that in the fall, some students will be studying remotely. So thinking about where students are physically located. There were questions about, what student support services will offer. Other resources. So I'm wondering if you could talk a little bit about support for students.
Absolutely. Thank you, Eric. So yeah, I guess I want to start by just saying that all of my colleagues here today have been talking about the really important logistic things that the campus is doing related to COVID. But we also really want to acknowledge that aside from the very real concerns about COVID, this is also just a time of such uncertainty and stress and unrest for all of us, for our students, for parents, for all of us as staff and faculty at the university, both in terms of our jobs and wanting to do right by this community and do our best for this community, as well as in our own personal lives as human beings. So, we really get it. And, we're really here with you shoulder to shoulder, trying to do our best in this uncertain situation as it evolves. But recognizing that there's all of that uncertainty and stress, we want students to know that there's a lot of resources here for you, just as there always are, but with special attention to this present moment in time. And so Student Support Services is, of course, available to students. We're a set of deans who work with students sort of at the margins of more clearly defined services at Brown. So, you might know to go to residential life or health services for certain types of questions. If you're not sure where to go, Student Support Services is a great place to go. And we can serve as a sounding board for you, help figure out what are the right set of resources for whatever it is that you're dealing with or concerned about, help you sort of figure out the next steps in your process and work with you through that. So that's really what our role is, to sort of fill in the gaps between the other resources on campus and help students work through whatever difficulties they may encounter. And we, like many of the services on campus, are available to students regardless of whether they are going to be on campus in the fall. So we will work with students who are choosing to study remotely in the fall. We will work with students who come to Providence locally, whether that's in off-campus housing or on-campus housing to study. And we'll be available to students who might be taking a leave or who, are first-year students who will be starting in January. So we're really available to talk to any of those students, as are many of our partner offices, student accessibility services, counseling and psychological services, a lot of our identity-based centers like the Brown Center for Students of Color, our LGBTQ Center, First Gen Low Income Center, Sarah Doyle Women's Center, all of those services, as well as our colleagues who are doing academic advising on the college side. So, we're really talking to each other on a daily basis to make sure that whether students are here or studying remotely, that that we're available. And we too are still trying to figure out exactly what that looks like. Even if we're both physically on campus, we might have a remote meeting, but we also might meet in person with masks and a few feet apart, or meet outside on a bench to talk as the semester progresses and as we sort of get updated guidance as the fall goes on. But we just want you to know that we're here and that we recognize that this isn't just about staying well physically and caring for yourself, but also caring for yourself mentally and your overall well-being.
Great, thank you, Jean Shiner. Dr. Pallant, there are a number of questions that ask, what if I'm exposed to COVID? Or what if I, God forbid, test positive for COVID? What will my support look like?
Sure.
What would isolation and quarantine protocol look like? I was wondering if you could talk about that.
Sure, be happy to, and I hope that I can do my best to keep this relatively clear. The good news is we do have set aside housing to accommodate students that either are COVID positive or COVID exposed. There are two different categories, and I just want to touch bases on each one. We have full staffed medical care. We have a medical school. We have an emergency room, emergency transport service, and very, very close ties to hospitals. I'm not hoping or expecting that anybody will get that significantly ill, but we have coverage 24/7 and a very tight group and very close by care circle that I feel extremely secure about. So, if part of what people are worrying about, what if I get really sick, that's almost the easier part. We got you covered, and we have a wonderful community that can help in circumstances of illness, and we do that all the time. I do want to point out a little bit of a difference between the concept of quarantine and isolation and testing. It's important that you understand. this, and it's a common misconception. If you are diagnosed with COVID, you'll be placed into your own room. The concept is isolation. While you are sick, you are contagious. We will try to keep you away from other people to the best of our ability. We will be checking in on you at the very minimal daily, more if necessary. We have a process by which we can get you medication. We'll deliver you food. You'll have your own room with a bathroom. May not be the Hyatt with a swimming pool on the ground floor, but it will certainly be sufficient. And the general protocol is that if you have had COVID, you will need to be in isolation for at least 10 days after the first day of your symptoms before you're deemed no longer contagious. It gets a little bit more complicated if you're a contact of somebody who has COVID. Those individuals who have had what we call close contact, this is not casual. And I know that there are concerns now about this idea that COVID can be passed through aerosols. Even though that information is being vetted, it doesn't mean that suddenly there's going to be more COVID than we've seen in the last 4 months. You don't get COVID by passing shoulder to shoulder in a hallway unless somebody really coughs or sneezes directly in your face. You do need to have close and sustained contact for some window of time to be at risk. If you are at risk, unfortunately, everybody's going to suggest to me, well, why don't you test me and see if I got it? And the answer is, I can't. Nobody can. If you've been exposed, we are going to be asking you to be in quarantine, which means essentially also by yourself in a room to the greatest extent possible for up to 14 days. The reason is that if you happen to pick up the COVID virus and it's just sitting quietly inside you, but hasn't decided to have babies and take foothold and get you sick yet, we can't find it. There's no test that we can do that says you have the COVID sitting in you quietly, kind of hibernating, waiting to come out. What we do know is if you've gone past 14 days beyond contact, I can say, okay, you don't have it, you didn't have it, you won't get sick. But if I could prevent anyone from going into quarantine by testing them, trust me, I would. I don't want that to happen to anyone. But if you have been a contact of an actively infectious COVID individual, you may need to be asked to be quarantined for 14 days, which is even longer than the individual who's been COVID infected, because they can conceivably get out in 10. For us to be sure that you don't become sick, the concern being that you could begin to spread the disease before you show symptoms. And that's, if you're going to become contagious, we want you to have that circumstance happen in a contained circumstance. We will be caring for everybody, be they off campus or on campus. All students have insurance, all students have access to health services. I don't want people to feel like there's going to be any differentiation of care, be they undergraduate, graduate, or medical student. We're here to care for all.
Thank you, Dr. Pallant, and I appreciate your comments about the insurance issue. A number of people had asked about that, so thank you. Dean Shiner, did you want to follow up?
I did just want to add briefly that in addition to everything that Dr. Pallant added, any student who is ill, either in isolation, in quarantine, or ill with some other illness, we often work with those students on any academic adjustments. So I know that there were some questions on, if I get sick, how do I deal with my classes? How do I stay on top of things? Dean and Student Support Services will work individually with each student and help them to communicate with their faculty, help them to come up with makeup plans and alternate arrangements. We'll help to coordinate that food delivery that Dr. Pallant talked about. And just to answer, I think, a question that I saw in the Q&A, for students who are living on campus, we'll be able to make sure that you have food, even if you are not on meal plan, if you are quarantined or isolated. So please know that if you are not on a meal plan but living on campus and end up needing to be in isolation or quarantine, that food delivery would be available in that instance as well.
Thank you very much. There were a number of questions that were variations on these two student questions, and I'll pair them. But this was a big area of response in terms of the pre-submitted questions. One is, how will you ensure that students follow public health guidelines? And the other question that a student submitted, that many students submitted variations on, was what happens if students violate the rules? And so maybe Director Purdie, you'd be willing to start and maybe talk a little bit more about the public health campaign that you're working on, because I think there are proactive ways in which we're thinking about this. And then maybe I'll comment very briefly at the end on some of the reactive ways.
Sure, absolutely. So one of the things that is really central to the campaign that we're doing is consistent positive reinforcement. So being able to have staff and students who are really paying close attention and encouraging people to continue the positive pro-health behaviors that they're already engaging in. So we have an expectation that students are going to be coming back to campus, and because this has been going on for quite some time, they are going to have some behaviors in place that are healthy. They are going to have behaviors in place that are keeping themselves safe, their families safe, they're putting their friends' health and safety as a priority. We're going to do everything we can to continue to encourage those behaviors. We're also going to make sure that there are no barriers to adhering to policies. So listening to students. If someone says that there is a very specific reason why that practice can't be followed, we want to know why. When we want to remove the barrier, we want to make it easy to follow all policies and procedures that ensure safety. And really the thing that is central to all of our work, if somebody is not able to or just doesn't follow a procedure or a guideline, is that we are here for education. That is at the center of everything we do. So we want to be able to know, again, why, how can we help? How do we make sure this doesn't happen again? How do we allow the community to come in and explain the impact that somebody might have had by not following those guidelines? But how do we also do that proactively, like Eric said? So yes, we can do that in a responsive way, but we can do that in a proactive way. And that's a little bit of the storytelling and the pro-health work I was talking about before, which is we're really going to be highlighting people's experiences of why they're following guidelines, how important it is to them, how important it is to their family, their well-being, their safety, and what their expectations are of their community. So students really being able to tell students, this is what I expect of you and this is why.
Great, thank you so much. I was wondering, we have gotten a number of comments in the Q&A about how students can provide more input or get involved. I was wondering if you could talk a little bit about how students are going to be involved, the different ways they're going to be involved in the public health campaign.
Yeah, we have several different ways that students are going to be involved. One of the ways was starting with a presidential intern process, which we just closed the application for, but I hope some people who are on the webinar applied for it for the 3 weeks that it was open. We are soon going to be able to hire that group of interns and a couple other staff in the Office of BWell Health Promotion who are students who are really going to be part of that peer education group that are reaching out to other students to get feedback, to get input. And so we're going to start to create a system for input so that, you know, easy ways to just type in that, you know, this is what I think we should do. But also other ways that are a little bit more enriching so that we'll be able to hold focus groups. Students will be able to ask questions of one another about their practices, about behaviors, about what their needs might be. So there's some information that's pouring in that is definitely quantitative, but our next step is that really qualitative, rich information about needs and really feedback as our process goes. So a couple of people talked about this, but things will evolve. We will be listening, adjusting, pivoting, and making sure that our evolution meets the needs of our students and is based on their input and feedback.
Great, thank you so much. As I mentioned at the beginning, there are going to be webinars later this week and next week on different topics, and one will be community. And I know that there will be a discussion in greater detail of these types of questions around what happens if students struggle to follow the public health guidelines. I do want to, in the interest of transparency, share that Conduct will review situations where individuals or groups of individuals are struggling to adhere to the public health guidelines that every member of the community is going to be asked to commit to. So again, this is not a specific student issue. This is an entire community issue. Employees, faculty, and staff will be asked to commit to following public health guidelines. So this is something we're working on together as an entire community. Students will not be held to a different standard, even if some of these public health guidelines may play out differently in a student's day than it might in a staff or faculty member's day. And again, conduct's focus, similar to what Director Purdy shared earlier, is often focused on education, restorative justice practices. Because of the health considerations, there may need to be an ability to move while due process is important and has to be ensured a little faster than may be the case in terms of other types of situations. And I will say, and this is a conversation that none of us take lightly, but that every college and university in the country is having, that in severe or repeated cases, I would like to believe the vast majority of times that someone is not following a public health guideline if they're a staff member or if they're a student, it's that they actually don't know, and what they need is more information and more support. But in those cases of intentionally severe or repeated violations of public health guidelines, you know, there could be sanctions, and those sanctions could be up to, you know, removal from campus or academic suspension. So, you know, those cases I expect to be rare, but quite frankly, if you were to have an off-campus party in violation of the Department of Public Health and Brown public health guidelines, and you invited 100 people, that would be considered severe. And it would be something that we would have to address. And in fact, the state might address if you're living off campus. So know that that's not the goal, and it's not the primary way of thinking about how to help people sort of work with public health guidelines. But it is something that I think is important for us to share, and we'll talk more about it at the community webinar next week. So I'm curious also, we've been getting some questions on the Q&A, and Dr. Pallant, one of the questions was, in terms of your discussion of testing, and thank you again, could you share whether there will be any distinction between on-campus and off-campus students in terms of participating in testing?
No, that's a simple answer. How's that? And keep in mind, it's testing not just students. It's the entire Brown community, because students interface with staff and physicians and other people. So the testing will be for the known interface of people who are part of the Brown larger community world. Great.
And just as a quick follow-up, we've had a couple of questions about antibodies and testing for antibodies and what that means.
Sure, I love this question, and I'm sure I'll get some blowback, but I'm going to come right out and say that the antibody tests are, at this moment in time, meaningless. The metaphor I'll use as an old doctor is I can test you for herpes, and you can have antibodies to herpes, and you can still get herpes. Don't take that to mean that if you get COVID, you'll get herpes, that they're apples and oranges, but antibodies are not the same for every disease. We have not yet established whether or not antibody presence means protection to COVID or means protection to COVID for more than just a brief while. So antibody testing is only useful for research purposes because it is a marker for who or how many individuals may have had it and never reported it to an official, but it has no bearing on clinical decision-making at this point in time.
Great, thank you for that clarification. I'm wondering if maybe Dr. Pallant and VP Guglielmo, you could talk a little bit. We've gotten several questions about temperature testing, and thinking about both the medical sort of thinking on that. People when they come to campus or enter a building, monitoring of symptoms, maybe more broadly, and then also thinking about facility access. I'm wondering if each of you could share a little bit of thinking on that issue.
I guess I'll I'll begin with the concept of temperature taking. The approach that many of us are taking is a reminder that will come to you daily to take your temperature and report any symptoms that you may have, and the checklist will be the symptoms that are potentially COVID-related symptoms. Should any of those be ticked off as positive, we'd have you communicate with the folks at Health Services. We will do telehealth, we will see you in person. And so we will ask you and we'll remind you to do active monitoring. I'm not going to do the deep dive into whether or not that's been demonstrated to be helpful or not. I think there's some question about it, but it won't be hurtful, and that's the approach we'll be taking.
And VP Estes, I would add, currently at this time, we are not linking temperature taking to building access. I think we're looking at more globally, as Dr. Pallant had mentioned, about if you have symptoms, we're expecting you to stay away from campus. And this becomes kind of a major responsibility on the individual.
Thank you very much. We've gotten a number of questions prior to the webinar and during the webinar about privacy and thinking about privacy in relationship to HIPAA and medical records and status, and then also thinking about maybe FERPA in terms of some of the work that Student Support Services does. And I'm wondering if Dr. Pallant and Dean Shiner, you might want to speak to how does that play out in the times that we find ourselves in?
Let me start off with the medical piece. I know that this may not sit comfortably with everyone, and parents in particular, but medical confidentiality sort of reigns supreme. The concept behind that is we would want any student and every student to be able to come to us for any question, any thought, any concern, any embarrassment for any reason whatsoever. If we begin to potentially throw up barriers, it actually, there's great evidence that you spread disease by having people not access care and cure and advice in the light of fear that their information could be shared and important people in their lives would find out and it would destroy their lives. That isn't to say, please understand, it's never my goal to try to say your student is now 18, you should never talk to your parents again. This is not in any way to try to prevent conversations between parents and their students. We always want that in the most helpful way. But the state law is extremely clear that if we were to communicate with another individual to tell them that they have been exposed to someone who has COVID, we're not permitted to tell them who that is. We will always be eager to, and we'll ask the student, may we be in contact with family, but we are required to get the student's permission before we can discuss any health matters with anyone beyond themselves. And there are not blanket waivers or blanket HIPAA waivers that are permitted that would suddenly say, I'm the parent, I can see anything I want for anything in that child. I know many a parent might wish that were to be the case, but because the ethical and practical implications of ensuring that students can come to us for anything, we will always encourage that we give permission to speak with parents, but we will defer to the student on that.
Yeah, and I would just add from the FERPA perspective, I think philosophically our approach is much the same, which is that we want the student to be the decision maker, and FERPA supports that in the vast majority of cases. I will say that when we are first in touch with a student who is not well, whether it's a standard flu or mono or COVID exposure, we ask just a handful of questions in that very first conversation. We ask, do you have any upcoming exams? What do we need to tell your faculty members? We ask, do you have any food allergies? Because we want to make sure that we're getting you the right food. And we ask, have you been in touch with your parents? And, if not, let's think about that. So, we are putting that at the forefront and helping students to have that conversation. And, if it's helpful, we can be part of that conversation if the student wants us to. Certainly, if someone were in a life-threatening situation, we have more flexibility and would be in touch with family members, you know, in a serious situation like that. And then in terms of if part of this question is about, well, what are we telling faculty? What are we telling suite mates or other people? You know, in general, when we communicate with faculty, again, we'll sort of craft that message to some degree with the student, but in most instances, we're saying, you know, Tim is not well and needs some support academically, needs some flexibility academically, or, you know, is managing a health situation. We're not saying students in isolation or quarantine or has COVID. So, you know, we're protecting students' information in that way. And similarly, if we would encourage you, you know, to let your suite mates know if you're going to be in isolation for 10 days. But if you don't and they call us, we'll say, you know what, we know where they are and they're safe, and that's what we can share with you. So we would be protecting students' privacy in that way as well.
And let me also just reinforce that in the unlikely, but should any student be completely incapacitated in the hospital and unable to, you know, we will err on the side of communicating with family or people they've identified as emergency contact. We're not going to say, you know, oh, they didn't tell us. We're not draconian in that fashion.
Great, thank you for all of that information. We've gotten some questions about thinking about indoor-outdoor kind of interactions. On the indoor side, thinking about community buildings like libraries and the campus center or the mailroom or you know, those types of spaces. And I'm wondering if maybe, Steve, you would be willing to talk a little bit about how the university is approaching, you know, are thinking about masks and social distancing and maybe even cleaning of those sort of spaces that we know, you know, members of the community use quite a bit.
Be glad to. Thank you, Eric. Much like classrooms, a lot of very careful planning is being done in terms of library use and other spaces. The mailroom, we're doing an assessment again to look at protection of the workers in the mailroom. We've already laid out, you know, the signage in that area. We know that that's a busy area. So, you know, between signage and pathways, you know, that will be set in a mailroom area or another busy area. And then we rely on students to help to maintain that social distancing. In libraries, we're looking at what spaces can be used and trying to use as many as possible to support, you know, the study spaces that we know are typically very busy, and that work is ongoing. What I'll say in terms of face coverings and the other pieces, they really are critically important to allow us to be able to go back in the fall and for the whole community to be safe. So if it wasn't obvious in the information that you read, face coverings will be required around campus whenever any community members inside of a building. And the only exceptions that we pointed out are if you're in you know, a professor in an individual office, or a staff member with an office with a closed door, or someone that's alone in the laboratory. And even in those cases, we're saying, please keep a mask with you in case somebody comes in. So I hopefully that helps with that topic, Eric.
Great, thank you. So we have only a couple more minutes, and I just wanted to say in closing, one, I realized that there were a lot of questions asked both pre and during the webinar about topics that we just weren't able to get to in terms of time, and also in part because those questions in some cases related more closely to the topics of other webinars, and really wanted to prioritize health and safety in this webinar. So I know that there were a lot of questions about housing and dining. There will be a housing and dining webinar tomorrow. We hope that you will join us for it. There were a number of questions about community building and activities and different types of activities and different types of ways in which people will hope to, both virtually, because there will be some people who will want to connect to campus who will not be able to come back or will want to study remotely. But also, you know, what are the opportunities for in-person interaction within the public health guidelines. So please know that we care about those questions and we take them very seriously, and we look forward to future conversations about them. In closing, I just wanted to say that you know, one of the things I've thought quite a bit about over the last few months, and I know gratitude is a strange way perhaps in this moment to think, but I am grateful that there has been a real centering and grounding of decisions in what is the best public health guidance and expertise available, whether that is you know, nationally or statewide, whether that is the expertise that exists within the Brown community. We really are focused on health and safety, yours and that of others. So I wanted to share that. And then finally, I know that this is hard, it's challenging. We've spent a lot of time, and I feel like we do this often necessarily, talking about things that we can't do and things that we you know, are not going to be able to do and that will be different in ways that are disappointing and frustrating. At the same time, you know, I hope that, you know, as we sort of journey together into and through the fall, we really can, and I think Director Purdy sort of said this incredibly well in many of her comments, that we can start to think about what we can do together. And what are the opportunities, even if we don't have all the answers right now and the public health guidance might change, you know, what can we start to think about in terms of opportunities and ways of being able to sort of be in community together, to work together, and to find those opportunities. I mean, I think that's one of the things I really appreciate working within the community of Brown, faculty, staff, students especially, that there is an incredible creativity there in terms of thinking about how to build community. And so that's kind of the hope I'll leave us on. And that I look forward to that. And I look forward to, and I know my colleagues do, seeing you all back on campus very soon. So again, thank you for coming today. I hope that the questions we were able to get to were helpful. I apologize if we weren't able to get to all of them, but know that you can continue to be in communication with us moving forward. There will be additional webinars, and we look forward to being in ongoing conversation as we all prepare for the fall. So thank you again.